A lot of people don't realize they might have anemia until they start noticing symptoms like fatigue, pale skin, or even hair loss. Hello, everyone, and welcome back to Reem Healthcast. Today, we're talking about something incredibly common, but often misunderstood: anemia. So let's start simple. What exactly is anemia?
Well, anemia is a condition where your body doesn't have enough healthy red blood cells or hemoglobin to carry oxygen to your tissues. And without enough oxygen, your body struggles to function properly.
So it's not just about energy levels. Anemia can have a much bigger impact on your overall health.
Absolutely, it can affect everything from your heart to your brain to your immune system. And what's even more interesting is that there are so many different types of anemia, each with its own causes and symptoms.
Then, what are the main types of anemia, and what causes them?
The most common type worldwide is iron deficiency anemia. This happens when your body doesn't have enough iron to produce hemoglobin. It's often caused by poor diet, blood loss, like from heavy menstrual periods, or increased needs during pregnancy.
That makes sense. But anemia isn't just about iron, right? There are other deficiencies that can cause it too.
Exactly. Vitamin B12 and folate deficiencies are also major culprits. These vitamins are essential for red blood cell formation, and when you're deficient, your red blood cells can become abnormal and less effective. Pernicious anemia, for example, is a specific type of B12 deficiency caused by an autoimmune condition that prevents proper absorption of B12. And then there's hemolytic anemia. That's when red blood cells are being destroyed faster than the body can replace them.
So what actually causes the body to destroy its own red blood cells like that?
It can be caused by autoimmune conditions, infections, certain medications, or even inherited blood disorders. It's one of those types of anemia that can have very distinct symptoms, like jaundice, dark urine, and an enlarged spleen. So it's not just about feeling tired or weak. Anemia can affect so many different parts of the body depending on the type and severity.
And what are the other underlying causes of anemia?
Then you have anemia of chronic disease, which is linked to long-term medical conditions like chronic kidney disease or inflammatory diseases. These conditions can interfere with the body's ability to produce or use red blood cells properly.
It's amazing how interconnected everything is. And I imagine anemia during pregnancy must bring its own unique challenges.
Absolutely. During pregnancy, a woman's blood volume increases to support the growing baby, which means her body needs more iron. If her intake doesn't keep up with this increased demand, anemia can develop. This can lead to complications like preterm delivery, low birth weight, and even increased fatigue.
What about children and babies? How does anemia affect them?
Anemia in children can have serious consequences for growth, learning, and immunity. For babies, especially those born prematurely, anemia is often linked to low iron stores and immature bone marrow function. Early screening is crucial because anemia during these critical developmental stages can have long-term effects on neurodevelopment.
Let's talk about symptoms. What should people watch out for?
The most common ones are fatigue, weakness, shortness of breath, headaches, and dizziness. And physically, you might notice pale skin, dark circles, hair loss, or brittle nails, and in some cases, even spoon-shaped nails. Also, pale inner eyelids can be a sign.
And what about more serious effects?
Severe anemia can affect the heart, causing palpitations or even heart strain. In cases of acute blood loss or severe anemia, it can lead to low blood pressure and can be a warning sign requiring urgent assessment.
So, diagnosing anemia early is key. What does the diagnostic process typically involve?
It usually starts with a full blood count, which looks at hemoglobin levels and red blood cell count. From there, doctors might order additional tests like iron studies, vitamin B12 and folate levels, or markers for kidney function and inflammation. Depending on the suspected cause, they might also look at a blood film or test for hidden blood loss.
And once anemia is diagnosed, how is it treated?
Treatment depends on the cause and severity. For iron deficiency anemia, oral or intravenous iron therapy is common. Vitamin deficiencies are treated with supplements. If there's an underlying condition like chronic kidney disease or inflammation, that needs to be addressed as well. In severe cases, blood transfusions or more specialized treatments might be necessary.
It sounds like a lot of the treatment revolves around addressing the root cause, which makes sense. But what about diet? Can what you eat help prevent or treat anemia?
Definitely. What you eat can make a big difference, especially if anemia is caused by low iron or vitamins. Eating foods like red meat, leafy greens, lentils, and even juices like beetroot or pomegranate can help support your body. At the same time, some things can block iron absorption, like drinking too much tea or coffee with meals, eating a lot of processed foods, or taking calcium supplements at the same time as iron. It's better to space those out by a few hours, so it's not just about what you eat, but also how and when you eat it.
That's good to know. How long does it typically take to recover from anemia?
Recovery time varies. Mild anemia might resolve in a few weeks, while moderate cases can take 1 to 3 months. Severe or chronic anemia might take even longer depending on the underlying cause. The key is early treatment to prevent complications.
So, when should someone see a doctor?
If you're experiencing persistent fatigue, hair loss, brittle nails, recurrent headaches, or breathlessness, it's worth getting checked out. And if you've already had abnormal blood test results or symptoms that aren't improving, don't delay seeking medical advice.
That's really helpful. It sounds like anemia is common but very treatable if caught early and managed properly.
Exactly. Whether it's related to nutrition, pregnancy, chronic disease, or something else, early detection and a personalized care plan can make a huge difference.
And with that, we've reached the end of today's episode. A big thank you to our listeners for tuning in. We hope this conversation helped you better understand anemia. Stay tuned for our next episode, where we'll continue bringing you practical, easy to understand health topics. Until then, take care and stay healthy.